Hi, everyone. It's really honored for me to be here and to share with you about our research. I am Cathleen. I have a double PhD from Mahidol University and Macquarie University, Australia. I am currently a research associate at the Faculty of Engineering, Mahidol University, Thailand. So today I'll be presenting about some of our study on the health risk assessment on heavy metals contaminations. Basically, this is a case study that we did last year. So without further ado, so our research is focusing on the small scale industries. It is a common business operated that we can find in Southeast Asia because it provides employment and entrepreneurships. And also the small scale industry usually sell their products in local or regional markets. So they basically met the needs of their nearby communities and surrounding. And usually these businesses are often started by the individuals or generation of families to families. One important thing to understand that even though these industries are small, they can have a big impact on our environment. It was found that about 70% of pollution from these factories comes from these smaller businesses. One reason is because they often don't have as many rules or inspection from either government, communities, and also they don't get as much attention from the mediator. Development of residential living in close to the workplaces, as well as supporting working families to co-locate childcare center services near the working places has risen nowadays by the number of childcare centers increase in industrial areas. So potentially, with this case, it could exposing the children and the communities to their health with the industrial emission and pollutants. So living near this area where industries operate or heavy traffic routes can increase the risk of respiratory problems, as we have now, and even can contribute to higher cancer rates. Therefore, effective urban planning needs to carefully assess these health risks from various sources contamination, including emissions from small-scale industries and the heavy road traffic in these areas. Speaking of industries, dust from industries can enter through the indoor through the ventilation, especially natural ventilation. This natural ventilation is very common in Asia, especially in South Asia. Not only that, factors such as street morphology, the cleaning practices, and road activities is also contributed to indoor dust levels. As given that humans spend over 90 days of their time or our times in indoors, like at homes or schools, that's why indoor quality nowadays is a significant concern for human health. Therefore, proper management is really crucial to address and improve the indoor air quality. Let's think like this. Imagine if there's a childcare where the kids or the adults spend 8 hours at least in this place, and then this childcare center is located near industries and relying mainly only on natural ventilation. Is it safe? What would be the air quality be like? Therefore, it's essential to ensure proper ventilation management because of the situation could pose health risks to the communities, not only adults, but children, through several pathways, inhalation, dermal, and oral. So basically what we did, we conducted our research in Thailand in one of the provinces, about 48 kilometers from Bangkok. And this area cover about 20%, 27% water, 30% agriculture, and 29% urban areas, where 715 registered companies with significant metal industry presence, like the steel production, aluminum production, metal recycling, and so on. So what we did was we selected 4 specific locations, including the background area, which is located far away from the main source. In here is the industrial zones, and a childcare center, which only located 1 kilometer from the industrials. So how did we collect our samples? We collected our samples using the portable sampler for the indoor, which is we collected in the childcare center. And for the outdoor itself, we utilize a DIY setup. So we are using a fish pump and then the air and the air sampler to collect the outdoor air. This was also with the collaboration with other university, King Mongkut University in Thailand. So on the near side, you can see like the installation on how we collect our samples in different area, like the background area, industrial, and this is like the main pictures how we collect our samples. So our samples were collected during the dry season, which in Thailand is November and February. But then this dry season was categorized into two periods: the cool dry in November and the hot dry in February. These are basically categorized by the meteorological factors. However, today I will only be focusing on the risk assessment during the cool dry season. And for the setup measurements, we are using the standard. We are using good glass filter paper, and then the flow rate we set to 5 liters per minute. And then from the samples, the air samples that we have, we try to analyze the heavy metals by sending our samples to Australian Institute using ICP-MS analysis. Not also to forget to mention that we also collected soil samples in this study, and then we analyzed the heavy metal concentration using portable XRF. So basically, this the soil samples that we collected, it was just only the surface area around like 0 to 20 centimeter depth. So this is a little bit of the result that I could share with you. That in our study, what we found that during cool season, that PM 2.5 concentration as our main target, it went above the national standard and the WHO guidelines, where the industrial zone was really high. But then when we see during the hot dry season, which in red color, things are changed. It was found that the outdoor childcare center somewhat recorded highest concentration, and then followed by the industrial zone. So what we can see that that's some roles that could play factors in these variations. And in the table on the right-hand side here, we could see the indoor and outdoor relationship in the childcare center. So our study discovered that most of the times, the indoor air had more PM 2.5 concentration than the outside, especially on the day 3. So usually this childcare center, they only use the natural ventilation, but then on this day, specifically on this day, they close all of the windows and doors, and then they turn the AC. And also in our record that on this day, they are doing some activities like cleaning and also like sweeping, mopping, and which this can stir up particles into the air. And after the day 3, the indoor air quality aligned more closely with the outdoor air. This study underscored how the indoor activities and the ventilation practices can impact air quality, particularly in a setting like childcare centers. Also, not forget to mention that all these changes in the ratio of indoor and outdoor concentration can be linked to the weather variations during our sampling period. Specifically, like some days when we collect our samples, it was like rainy days. And next is about the heavy metal concentration in PM 2.5. So among all the locations, our studies showed that aluminium had the highest amount of heavy metals during the cold dry season, while zinc had the highest level during the dry season. So we compared all of the heavy metals with the International Organization standard. Generally, all of this level will be below recommendation guidelines, except for the lead in industrial zone during cold dry season. Interestingly, the indoor childcare facility showed the highest amount of lead among, like, compared to all other locations. That's really interesting because in our hypothesis, it was mainly because of the dust buildup that from the nearby industrial activities, and also from the materials they are inside of the childcare center, and also some activities that the children did at the time, like when they are playing and doing other things. Okay, and next is the heavy metal concentration in soil. What we have found here that in surface soil, aluminum still the highest concentration all across the area we investigated. Upon comparing these elements at different locations, the industrial area exhibits still the highest elevated of aluminum metals, particularly, all metals, particularly aluminum. Fortunately, most metals concentration met all national standard. PCD is like Pollution Control Department in Thailand. Except for the lead in industrial zone, where levels were nearly 3 times higher than permissible limits. Usually in Thailand, in most case studies, we found around 86 until 4,000 milligram per kilogram, which is really high. This highlight content strongly implicates of human activities, like industrial processes, as the primary source of pollution in this area. And also, if we see the result between soil samples from the childcare center and the near main road, show that the PB level, the nickel, lead, and arsenic and other chemicals, or heavy metals, it's most likely in the same range. Lastly, what we did, we tried to analyze what the health risk assessments between PM 2.5 and the soil. What we found that the hazard index value was above 1, especially in childcare center, indicating the health risk associated with indoor air quality too. And also with the soil, it's quite high. If you look the total carcinogenic, it's still in safety limit, which is good news. But even though the risk seems okay, we're still saying it's super important to keep monitoring things as safety precaution. We want to make sure we are keeping close eye on everything managed safety effectively. And lastly, for the conclusion, in other investigation or analysis, we found that the majority of the source of this PM 2.5 and heavy metals level in both air and soil were found from industrial activities and the traffic emissions. This suggests that industries nearby can significantly impact the environment around them by releasing these pollutants. That's why choosing location for a childcare center, especially away from industrial area, becomes crucial to ensure safer air quality, especially since we discovered that elevated lead level in indoor, likely from building materials and children activities. This study emphasizes the need for effective indoor air quality management and pollution control measures. During the cold dry season, we found that childcare center near industrial zone and main road face increased health risk from these pollutants. To address the challenges involving policymakers and communities in developing targeting intervention is also essential for protecting the public health in affected area. So before I close my presentation, this study was supported and funded by Mahidol University, Thailand, Macquarie University, Australia, and Kyoto University, Japan. So that's all for me. Thank you very much.